Hello, Moises. How are you?
Hello, how you doing?
Good. Thanks for doing this for me. I wanted to show a video of how I do my sessions.
Okay, yeah.
And so you were telling me that you're having your elbow is hurting.
Yes, my right elbow
Mhm,
sometimes feels like it's swollen. You
mhm.
can't see it, but I feel it, and there is some pain.
Okay. All right. So we're gonna check what's going on. What is that about? And the first thing that I'm gonna do is I'm gonna give you a quick energy scan just to check how's your energy.
Okay,
So just relax. You have not to do anything. I'm just gonna scan you, okay?
okay.
Really quick. Okay, so okay, all right. So I felt a very strong blockage in your throat. Like you really have sometimes to avoid problems, you rather just hold up and not say anything. Um, Also, you worry too much. You worry that you're not gonna be able to do something or to have something. Like you worry.
Yeah.
Then I felt also a little bit in your heart, some heart emotional sadness, something in your heart.
Okay.
Does that make sense to you?
Yeah, it does actually. Yeah,
Yeah, you think too much, you worry too much.
I do. Yeah, I do.
Okay, all right, so now we're gonna ask, I have a list here that I'm looking at, sorry, of all the things that it could be the problem in your elbow. So I'm going to muscle test with my fingers and ask what, okay, superconscious tells me, Moises' elbow, is it because of pathogens like virus, bacteria? No. Is it structural like bones, nerves, muscles? No. Well, muscles? Oh, yeah. Muscles. Okay. Is it nutritional? No. Is it energies? Yes. Emotional? Yes. Okay. Is it toxicity? No. Chakras, organs, glands, meridians? No. Okay, so it is a muscle and it is emotional,
Okay.
the problem. Okay, the emotion behind it, the elbow, means that you do a lot of work and you don't feel anybody, not anybody, but you don't feel valued enough or recognized enough. Like you are like, oh my gosh, I do all this work and nobody sees all this work that I'm doing. They don't recognize, like, do you feel like that sometimes?
But yeah, yeah, I do.
Which is, sometimes it's not real. We
Uh,
just want, "Oh, okay, I made all this work, I just want to go to bed, bring me something to drink." And then they don't, you're like, you don't value my work. Nobody knows all the hard work I do. It happens. So what I'm trying to say is that it doesn't necessarily is real, because you know what, you don't need the approval of anybody. If you value yourself, you know that you don't need anybody to value yourself.
okay.
So that happens to you, right? A lot.
Yeah.
You do feel that way. Okay, so then that is the emotional behind. So we're gonna have to do a reprogramming on that, changing your belief system. um okay, let's see, where's, okay, so how would you like to feel? How would you like to feel that what do you need? That you need them to say thank you, or you need what is exactly what it makes you, will make you feel good?
Uh, uh, I guess yeah, like an some kind of acknowledgement, you know, yeah, thank you, or um, yeah, I mean, basically just acknowledgement, you know, like understanding what I'm trying to say or what I'm trying to do, you know, from whoever, you know,
So,
I'm asking that from.
so you need it with words.
Yeah,
You need to hear.
yeah,
Okay. Obviously that comes from back in the days.
oh,
You know, maybe you were not heard. Did that happen to you in your family?
yeah, yeah. I've always felt that way with my family.
Can you tell me more about that?
I think it's more with my mom that I have that problem with.
Hmm.
Um, every time I, you know, we live with her, and and we try to give her as much help or advice as we can, and uh, sometimes it feels like she doesn't take our opinions or our help, you know,
Uh-huh.
either seriously or she doesn't accept it unless she hears it from somebody else. Then she's like, okay, all right, then we'll do
Okay.
that. Or
So what you feel is like your words doesn't have a strong influence. Like
right,
you talk, that's why you have a throat. I told you about the blockage in your throat. So
yeah,
you think that the words that you say doesn't have a value. Like nobody listens, nobody
right,
cares.
yeah,
Right?
yes, yeah,
You feel that, especially when you have little kids, right?
yeah, yes, yeah,
Like, oh my God, they're listening? No,
yeah,
yes, they are, but they just can't help it. They're exploring
right,
the world. Has
yeah,
nothing to do with you.
yeah,
So we're gonna do a reprogramming on that right now. Okay,
okay,
what we're gonna do is you're gonna say every time I speak, my words are respected. I mean, let's find out what is the best sentence for you. Every time I speak, my words have value or are heard. Or what would you like to say? Every time I
um,
speak, my words what?
have value would be good. Every
Have
time I speak,
value.
my words have value.
Okay. Have value and appreciation or recognition or
Okay,
recognition.
recognition. Yeah,
Yes, every time I speak, my words have value and recognition.
every time I speak, my words have value and recognition. Yeah.
You would like that to happen every time you speak.
Yes.
Yes. Okay. All right. So what we're gonna do is we're gonna do a Psyche method. You're gonna cross the right feet over the left foot,
Right over left.
uh,
Okay.
and then your hands to the right over the left, and then hold your fingers like this, and just rest it in your lap.
Okay.
So out loud, you're gonna say, every time I speak, my words have value and recognition. Every time I speak, my words have value and recognition. Every time I speak, my words have value and recognition.
Okay.
And then you're gonna close your eyes and you're gonna keep saying in your mind over and over and over and over, and your body's gonna feel funny because it doesn't believe it.
Mm.
And maybe you're gonna forget. And then you just keep going and going until you literally are gonna feel super, like almost like tired and sleepy, very relaxed. It might
Okay.
take 2-3 minutes, and then we check. Okay.
Okay.
All right. You can start now. 3 times out loud, and then you close your eyes and you say it in your mind.
Okay. Every time I speak, my words have value and recognition. Every time I speak, my words have value and recognition. Every time I speak, my words have value and recognition.
All right. Okay, you can now let go of your hands and your feet. And then take a deep breath, very deep. Inhale and then let it out. Okay, we're gonna check. What's the reprogram? Yes, it says yes. So your body believes it now. Your body believes that every time you speak, people will give it value and recognition. And so that's something I want you to write down and to have it there and say it all every day. You know, we already work in the subconscious, but sometimes we tend to go back to the comfort zone, and the mind is very tricky. So
Yeah.
I want you to say it for the next 3 days when you go to sleep. I want you to go to sleep, and right when you close your eyes, your brain goes into waves that are self-hypnosis, like it calms. And then you're going to start saying, every time I speak, my voice has value and recognition. You know, go on and on until you fall asleep for the next 3 nights. Okay.
Okay.
And so that's what it is. That's what your elbow pain is that you feel that you don't have recognition. But you know, it turned out to be more about your vocal than your physical effort.
Okay.
It's more like, oh, I do a lot of work trying to communicate, trying to, you know, the kids, the mom, whoever at work.
Yeah.
It's more that it's all this effort for them to recognize what I'm saying. That's what is causing your elbow pain. You will see once you start believing that your voice has value and they listen, you're going to start feeling better. It's going to go away because the body just sends us messages, you know.
Okay.
All right. Do you feel good?
Yeah.
Now, every time you just speak, boom, they're going to listen.
Okay.
Okay. You wanted me also to, you said your dad passed away.
Yes.
How
He
long
passed
ago?
he passed away in '06, which is what, 15 years ago? Bad at math, yeah.
Okay. So you want
2006.
me to see if we can communicate with him, right? What is his name?
Fidel.
Fidel.
Yeah.
All right, give me a minute. Let's see if Fidel can come down and talk to us. Did he like to wear boots, or like like a cowboy style kind of a person?
No.
Not at all.
No.
Okay. Well, I see him sitting like on a porch, like you know, outside of a house. He's very happy, by the way, and he's telling me that, like, did he had a ranch? Did he like things about ranches or the open
He
fields?
he grew up he grew up in a ranch in a small town in Mexico, in Zacatecas. That's where he was born. You know,
And
it
he was
was wide
happy
open
there.
area.
He
Yeah,
was
he
happy.
was. Yeah,
Okay.
yeah.
So he's, you
He
know,
used to
because
talk a lot about it.
oh, okay. So I guess he, you know, when people passed away, they recreate whatever was the happy times or whatever they made their homes. They recreate that
Okay.
until everybody regroups again. You know, like all of you, you know, they're waiting for everybody to regroup again and
Okay.
then see what they're gonna do in the next incarnations. So he's there. He's happy. Did he play an instrument
No,
or liked an instrument?
he didn't play instruments, but he liked to sing.
Oh, okay.
Yeah.
So because I see him like in a party, but there's people like playing. I see like a violin. Was he like
Yeah,
a the kind of person like that likes parties and social?
yeah. He enjoyed, um, whether it was visiting family or, every time there was a party, we were always there.
Mhm.
So he was he loved to dance. He loves to
Oh,
dance.
right.
Yeah. So
Okay. So then
yeah.
that's him. That's totally him. And did what he said? Did he had a good friend that he still lives? Do you know about that?
A good friend.
Or no, I'm not sure if I think no, I'm sorry, it's not. I feel like he just probably someone died that was a very close friend of him or a family member, and he's
Mm.
telling me that they're together. Was that a good friend or a family member that was close?
A friend. I mean, friend. I'm not sure, but I mean, my grandpa passed. His dad passed. Um, two of my cousins have passed. And
Oh, okay, a lot of family.
yeah, yeah. I mean, mainly family that has passed away.
From his side, like his
Yeah,
family.
yeah.
Yeah, okay. So just so basically what he's saying is they're having a party over there in that place. Because I see music, I see people, they're closed,
Yeah.
violins. I don't know why I see violins and you
Uh,
know
the
the how do you call that instrument?
the accordion.
The accordion.
Yeah,
So he like that kind of a music, I guess.
he like more. In Spanish, it's called like grupero. He wasn't
Oh,
that much into like mariachi or banda, but my family here, I have cousins that play in bands that have the accordion, and
mm,
I have family that love mariachi too. So, but anytime there was music, my dad was always there, dancing with
yeah.
them. So,
So he's living the life right now.
yeah.
And he also tells me that he doesn't feel any pain. I don't know if, how was the cause of the death, or he was in pain. He said that he doesn't feel pain. He sees like very flexible.
Okay. That
What
that
happened?
makes more sense. He had Lou Gehrig's disease, where um, his muscles were deteriorating. So by the end, he couldn't move. He wasn't able to
Oh,
move. Yeah.
okay.
He lost a ton of weight
Mm,
because he couldn't eat properly. He couldn't chew. He couldn't exercise. He couldn't walk.
oh,
So his
sorry.
muscles were just getting tighter and tighter. So he couldn't. So
It's hard.
yeah,
Well, well, in case you wonder, that's how he is right now. He's happy dancing with people in this place that he loved. He's flexible.
yeah,
So he's
right,
good. Just waiting for everybody to regroup. So that's what
yeah,
he's saying. Not your time yet. Don't worry about that. But we're all gonna have to, transition
right,
one day.
yeah.
Is there any question you want or anything you want to?
Um, you know, for my dad, not at the moment.
So you're just good to know
I
that
just
he's
wanted to hear that he was okay.
yeah,
He's feeling
more than okay. He's
good. Yeah,
partying.
great.
All
That's
right,
good.
okay. I'm just gonna close that and thank you so much for coming. All right, gone. Okay, well, Moses, thank you so much. Work on that I told you.
Yeah,
Believe it and say it and repeat it and convince yourself, and you will see that people are really, with the first time you speak, they're gonna listen to you.
okay. All right.
Seriously, that's
Yeah,
true. If you believe it, it's gonna happen.
okay. Sounds good.
Practice. Sounds very good.
Yeah.
Okay, well, I'm
Thank you
gonna
so
send you
much.
Reiki later.
Okay.
Reiki at distance. I'm gonna send you Reiki to help you, just enhance everything we talk about. Even if you don't remember, it's in your subconscious. Your subconscious and I are talking.
Okay.
And just Reiki is gonna help you to get you stronger and get
Okay.
rid of the blockages that I mentioned. So
Mhm.
you start feeling better with your elbow. Okay.
All right. Thank you so much. Thank you.
All right. Well, thank you for doing this.
Yeah. Yeah.
Okay, talk to you soon. Bye bye.
Bye bye.